moving on to the injections. How are we doing with time?
11 o'clock.
Okay, well, we wasted like 15 minutes getting technology to work. Yeah, there's Carbojet Edex by Trimix. Carbojet is brand name. We don't deal with it. It's monoactive, one ingredient. It's large volume, big needle comes with the package. I used it once just because I use everything for my book. I wrote a book. By the way, we have 2 books here, and at the end, whoever asks the most interesting question that makes me think, we'll get a book. Okay, only 2. So anyways, I tried a bunch of stuff just because I wanted to come from a place of knowledge, not because I needed them. Yeah, right. But anyway. So yeah, the dosage is different. Dropout rates, yes, some men. It works. All these products, most of them work, I would say, 90% of the time. Some of them work too well, and the erection lasts for more than 3 hours, which could cause issues called priapism. You don't want an erection that lasts that long because blood tends to start coagulating in the penis, and eventually gangrene or infections can happen. So that's why patient education is humongously important. We made a video at B5 on the injection technique because people were getting prescriptions without being told how to inject. They were just being given a drawing. And so we have on Excel mail, we have a video that I tell everybody, watch the video, read, and we have like a 4-page information pamphlet that they have to read because it is something that works really well, but it can also create problems. And a few people have to go to the emergency room in the middle of the night, and no doctor wants to get a call in the middle of the night because their patient got priapism. So, and we do sell a product that is an antidote, by the way, which I'm kind of surprised that a lot of doctors don't know about, so we'll talk a little bit about that. But pain and priapism, fibrosis, if long-term users can start, depending on the injection site, reactions and all that, create fibrosis. What is fibrosis? It's basically a buildup of calcium inside the penis that eventually gets in the way of blood flow. But this is like after 5, 7, 6, 7 years of this product and actually injecting on the same side and not doing the right technique. It's a product that requires a lot of education, okay? And yes, a lot of people are ordering, and I'm sure it's a health seller too. I think PDE5 inhibitors are number 1.
Number 1. Yep.
The penile injections are.
Trimix, what do you think that is on the list of top prescribed medications?
I just pulled it yesterday.
Top 10?
It's in, I would say it's in the top 25.
Top 25, okay.
Yeah.
A little bit lower.
Yeah, and it's, some, obviously there's still fear about it, and there are other options that may want to try before they get to this. This is what I call not only salvage therapies, meaning we've tried several things, and PDE5 inhibitors may work in 60% of men, 40% of men don't respond. They don't. Or it works, but sometimes they don't work all the way. You cannot predict, and I hear that a lot, so that's one issue. And men want to try this, and some of them get tired of injections, so they eventually go to the urologist for an implant. And so as I said, this is not salvage completely, it's free salvage therapy because salvage is always split as surgery. Okay, so pain in the administration of prolonged erections, hematomas, having a bruise there is not fun to have. So we have different formulations. Bimix has 2 components, papaverine and phentolamine. Trimix has 3 components. With prostaglandin is an additional component. Quadmix adds atropine sulfate. So Bimix, they all work. I cannot say we have ever had a study comparing each one. I would say Bimix works really well. Doesn't require all the refrigeration that all the other products require. Some people, men that travel a lot, actually, some doctors prefer prescribing Bimix first. Some doctors jump right into Trimix. Quadmix is not as well known. Sometimes it's used for men that are starting to lose efficacy on Trimix. Definitely, that's for what makes. And then there's super Trimix. I'll show the different ratios there. That some doctors just feel like ordering something called super is probably better. That's my opinion, personal opinion, obviously, because Trimix works well in most cases, anyways. So sometimes it's a matter of the doctor prescribing habits or the way they market their services. And probably the salespeople, especially in the field, have also had to deal with, because I've heard the questions, with doctors that want their own formula, their own ratios, because that way they can tell the patient, I'm the only one that has this. So it's a marketing kind of thing, but we don't do customized formulas for them. This is what we have, which is a lot, 6 different formulations, and basically one is the main seller. Obviously, there's a lot of info, I'm not going to go through it, but this is just to tell you that each one has a different ratio and different components, obviously. The bis, 2, tris, 3 components and all that. And then we also have phenylephrine, which is like Sudafed, but in liquid form that we sell as an antidote. I unfortunately have seen that most patients don't know about it. I wish they did. I've always wanted to have a kit that came from Empower, and we've discussed that has the Trimix and the antidote in the same box, especially for newbies. I call them newbies, the ones that haven't done it before, and how to teach them to do that, because that's a lot easier to treat that at home than having to run to an ER, and it's so embarrassing for most people. I've never happened to me, but I've had friends that happened to, and it's really a traumatic experience. So that's something that I really think would be nice if there was a way, and this is my suggestion, that when somebody orders a prescription, you call them back, ask them if it's their first time users or not, because there should be an option they should know about. And if they haven't gotten a prescription, they can talk to their doctor. And there's actually a protocol to follow, like being checked every 5 minutes until the erection starts coming down. So, yeah, it's and of course, Empower has beautiful brochures on each product. But as I said, we have a video, and videos do tell a lot better how to do the whole, especially pre-injection technique. So you do have to massage and make sure the product is well distributed, because if you don't do that, not only it doesn't work as well, but also you may have localized fibrosis that you don't want to build up with time, okay? And there's, as I said, there's this priapism treatment that I really think we, as an educator, need to make sure that everybody knows about, because they don't. So what I tell people that don't have a prescription is to get Sudafed, oral Sudafed, the real one, the one that you have to ask the pharmacist, because it's behind the counter. They made it so, what, 5 years ago, 7 years ago, because people were using Sudafed to make crystal meth. So it's, like an amphetamine. So now they put it behind the counter. It's over the counter, but it's behind the counter, meaning you have to ask the pharmacist, because the Sudafed that is on the counter is not the same thing. It's not as effective. So I tell people, have some Sudafed, especially newbies, and if you see yourself in 2.5 hours, 3 hours still having an erection, just chew one of these things. Don't even take it, just chew it. If that doesn't work, then obviously you go to the ER. So I know it sounds really traumatic, but it's a minority of patients. I would say less than 10% have this problem. Actually, some of them complain that it doesn't work as well, because obviously you have to start very small dose, because everybody's different, and that dose may not work. And the thing I tell people is that don't inject again. Let's say you inject a very small dose. Oh, it doesn't work. And then you inject again because you need, and you're building up, and actually that's what can throw you over the edge with priapism. Also, I tell people, do not take a PDE5 inhibitor, especially Cialis, within 3 days of doing this, because that can synergize and create more priapism. So there are many things. This is a highly I said, out of all the things I do, besides testosterone, when it comes to education, and injectables like this are require a lot of, but people are using it very successfully. It has saved, I've gotten a lot of love letters, love emails from people saying it saved my marriage. It really is. I wanted to feel like a man again. I tried everything. You know, this is shifted my whole life, and my wife is happy. Everybody, some of them complain that their wives are not that happy because they're tired. I don't want to be bothered so much more, you know, and that's another issue. But yeah, that's the thing about men when they increase their sex drive and erectile function is that sometimes they forget there's another part of the equation that you also have to be careful with. And some men are really afraid of needles, so they use this auto-inject device. I think it's more trouble than it's worth, but some guys on my side, they seem to like it. It basically hides the syringe, but the injection goes through the same way. You know, so it's more of an optics thing. It's another one, auto-inject too. As I said, the penile prosthesis or implants are options. They cost over $15,000. Most people get even Medicare to pay for it. And the vacuum constriction device, the one that, as I said, in the 80s, that was the only thing that we had back then. It's this weird device here where you have a little bit of a vacuum pump with a little a meter there to make sure you're not extending vacuum too much, because that could actually break tissue in the penis. But that was, and that's still being used, especially for men that are about to go for a prosthesis. They have to do this for a few weeks to expand their tissue before the implant. So Coverjet is Muse are these other products that are out there, they're brand name, kind of competing but not really. Coverjet comes in container, as you can tell. Look at that huge syringe. Looks like a horse syringe. And the needle too is big. When I saw that, when I got one of them, I was like, this is like, Trimix you can do with an insulin syringe, 29 gauge, 30 gauge, 5/8, little hair of a needle. This thing has like a 25 gauge, 1 inch or half an inch, and the syringe looks like something you're going to use on an animal. So it's, and it's high volume too. So it's pretty scary, but some guys say, hey, you know, I don't want to pay anything out of pocket, even if it's $50 a month. Or actually it's not, it's like $70, $80 for 5 cc's, which you only need 0.12 cc's. How many erections is that in 5 cc's? Whoever can do the math. I mean, one bottle of Trimix lasts a long time, and that's only $70, $80. So, hey, whatever, more power to them. This is the most traumatic one. I think this is I think I've only heard 2 or 3 guys that used to, because our insurance pay for it, but it's this pellet that has one of the components, and I don't know, I want to skip it because it really gives me like, injections don't give me the creeps, but this definitely does. This is a painful kind of a picture. And the costs are actually high too. The Muse, the Coverjet, all that, when it comes, look at the Trimix, $4, and that's per dose. I think it's actually lower than that, but you can see everything else is a lot more expensive. All right, so we're moving along. So bear with me, we're almost there. Okay, this is I have to say, this is the most difficult part for me, and not because I'm a man, obviously, but it's because the data is all over the place. Still struggling with getting products approved. Even the definition of female sexual dysfunction is more complex. Obviously, with men, we're looking at an erection. It's a mechanic thing, right? We're measuring, you know? In females, obviously, it's different. It's about arousal, orgasmic function, vaginal health and dryness, etc., stimulation. So there are many factors, and believe it or not, different studies have defined that sexual function in women differently. So the FDA has had trouble pinpointing one good measurement tool, gold standard for female sexual dysfunction. But it's getting better, because at least we have one product approved that opened the door. It's not a very effective product, but at least we got approved. So I think the discussion about female sexual function is increasing. because of that, we needed a product approved. I'm sorry, this is a little busy, but in at least one reference, 43% of American women suffer from sexual dysfunction, over 50 million or more women. Highest proportions between 18 and 29 young women. Why? Because they're also having more sex too, and they're before the childbearing years. But also older women have, especially postmenopausal women, have a lot of problems. Many women can reach orgasm with the clitoris being stimulated, but only half of the women regularly reach orgasm during intercourse. I saw a Netflix special on this, researchers and women and female activists talking about this, and many women in that special have never had an orgasm. They just didn't even know what it was, and it was basically all related to the male lack of ability, because it really is, about clitoral stimulation. So that, for me, in the whole special, was the main point I got. The fact that males suck at stimulating women. Males suck at making a woman comfortable and connect spiritually and intimacy-wise with women, which is part of the arousal. There are many things that we as men are doing wrong when it comes to, and we tend to be a little selfish, and we tend to reach orgasm quick and not do our job to make sure that's not the case, that we're not the first ones, but the last ones to reach that point. So it's very complex, and I do have to say that women have also been very understanding and polite, because obviously nobody wants to judge about reaching orgasm sometimes when they didn't. So that was also very evident in that series that I saw, the fact that some women are compelled to have to lie, just not to hurt their partner's heart, about their performance. So, and a lot of women in that program found orgasmic pleasure by themselves with toys and all that, because they actually could stimulate their clitoris. So I was fascinated. I thought it was an amazing special. If you can look into Netflix, because it's not only talking to doctors, but ladies that have been activists. They're activists now. And you were telling me how that whole world.
It's probably the one lady that we met at the NAMS that did that documentary on Netflix too.
Yeah. So it's actually not only the fact that we are as sexual partners are failing. Women are not speaking up as much, because obviously there's a male ego, and as I said, sexual performance anxiety it tends to be associated with judgment, and that's an issue. So there are different variables in the female sexual functions: the desire disorder, libido, lack of libido, the arousal disorder, a persisting ability to attain or maintain sufficient sexual excitement, an orgasmic disorder, persistent difficulty, delay, or absence of orgasms after sufficient stimulation, and pain disorder, persistent genital pain associated with sexual intercourse. So there are many factors involved. Sometimes, after, obviously I've been working in this field for a while, and sometimes I wonder that having sex, a good sex, and in great performance for both partners, is almost a miracle. There's so many variables involved, not only mental, physical, medication, stress, judgment, taboos, that it is almost, it's an amazing thing that when two people can have good sex where both reach orgasm and both are stimulated and happy about it. If you have that in your life, embrace it. Take care of that other person, because it really is not as common as people think. You hear from your friends that everybody's having fun, but sometimes you hear more stories on why they're bored. I'm sorry, I got a little distracted there. But I'm a gay man, by the way, but I did date women very successfully till I was 24. So I know a little bit of that. But I also know, as a gay man, I kind of take the female side too. I can explore the fact that I'm a feminist in many ways. So I do think that it's both ways. So anyways, let's not get too into that, because it makes some people uncomfortable. Although, you guys are young. You don't have the hang-ups we used to have back in the days. So menopause is obviously an issue there. Vascular disease, high blood pressure, diabetes, pelvic trauma, just like men. Basically, we're humans. We have the same issues when it comes. Fluctuations in the level of estrogen and testosterone hormones could be a cause of sexual dysfunction. Obviously, a fluctuation occurs monthly and during pregnancy. That can affect sex drive. In postmenopausal women, sex drive may be reduced because of estrogen levels decrease. We do have some products and creams that can deal with that. Sex drive may also be reduced in women who have both ovaries removed for obvious reasons, hormonal issues basically. A reduction of sex drive may result from anxiety, depression, etc., problems in the relationship. Kids, I mean, being tired, taking care of kids is a big problem. In my world, I used to do a lot of research. We used to complain a lot about the fact that we don't have enough women in any studies about anything. I mean, we used to do HIV research, immune research, all that. Where are the women? There's only 10% women. I mean, the world is not 10% women. We're not doing enough to bring women in. Where are women? And after studies were done and the sociological aspects, they found out that women were taking care of people. They didn't have time to go to study, you know? It really wasn't about not wanting to join the study. It was basically their ability, time-wise, to join the study because it's a luxury for a lot of women. And so the studies kept bringing basically child care, all that stuff, transportation, doing things to minimize, but I think we got the maximum we ever got to was 20%. So that happens too here when it comes to female sexual function. All right, so breast cancer survivors too have a lot of issues. Testosterone for women, and compounding is the only source of testosterone product for women. A company tried to approve testosterone gel like 10 years ago. Libido was called. I was very hopeful. I thought, oh wow. You know. But they did not get approved. They didn't meet the endpoint because the endpoint was really based on an endpoint, a definition of sexual harassment that was poorly defined. So the company basically let it go, which is good for the compounding industry because we're the only ones providing this treatment for women, which we have good data. It's not like we don't have data on the fact that it improves sexual libido mostly. And very low doses, obviously, not like men, 20 milligrams subcutaneously. Pellets can also work, and Empower is going to get into pellets.
January-ish.
January-ish.
Yeah.
Combinations not only with testosterone, but estrogen, progesterone, DHEA. We're not only talking about one hormone sometimes that can be provided for women. Side effects, too much testosterone, masculinization, fuzzy peach hair, like peach fuzz hair, or did I get that wrong? Little hair, mustache, what do you call that? Peach fuzz?
Peach fuzz.
Peach fuzz hair. Clitoral enlargement, menstrual issues, basically amenorrhea, either too much menstruation or menstruation actually ceased to happen. So, but those are, you know the dose is too high. So obviously all the doctors prescribing female testosterone and other creams here are doing so because they're very educated. This is not an easy field to get into. And we will have a training session with a physician that does basically female-related sexual health and products.
The sweet spot for women for testosterone that these doctors are targeting is about 10% of a male. So the sweet spot for optimal testosterone for a man is roughly 600 to maybe 1,200 nanograms per deciliter of total testosterone. For a woman, it's somewhere between 60 and 120. And that's the top range. And one thing I'll share with you, which is why a lot of these doctors have been doing this for a long time, know more than what's out there in the data. But most women that I've had the opportunity to screen, being on the clinic side, which is hundreds and hundreds of them, even in their 20s, have very low testosterone, and we don't. And it's mostly American women. There's not anything official on that, but there's some theories floating around. The fact that a lot of women get on birth control very young in this country. Birth control is like giving a young man anabolic steroids. It'll disrupt their own endocrine system, so that by the time that female is in their sexual peak between 20s, mid-20s, their testosterone is extremely low. I'm talking single-digit numbers we see all the time. Giving them a little bit of cream and getting them into that upper range of 60 to 120 changes their entire life. Unfortunately, this hasn't spilled over to the academic realm as of yet. It is now starting to get there. Me and Gabby learned at the last conference, but only pockets of women and doctors know about this.
Okay, so these are basically saying testosterone deficiency symptoms as men: fatigue, lack of sex drive, pain, loss of hair, increased body fat, decline in arousal disorder, depression, etc. Viagra for women. There are actually some references, some studies out there that show that it can be effective. It improves vaginal, clitoral engorgement and lubrication. You know, that's what PDE5 inhibitors do. They actually increase engorgement, not only of the penile tissue, but also the vaginal and clitoral tissue. 84% of success rate in decreasing symptoms of female sexual dysfunction, but it's not approved by the FDA for this purpose, but it can be prescribed through, obviously, compounding. What's the dose for women usually?
It's actually the same as men, 5 to 7 milligrams a day of tadalafil or 25 milligrams of Viagra as needed.
So we're not only, you know, Viagra really is the best known, but tadalafil can also be provided, obviously. Vaginal atrophy, a decrease of 50% of blood flow to the vulva after menopause can be restored by estrogen therapy. Regular intercourse also maintains, well, you know, when you're having vaginal atrophy, it's very hard to maintain regular intercourse. Other products, there's actually an approved product, a serum, that I don't know how well they're doing cell-wise to improve the atrophy issues and the dryness, and the DHEA. Can you talk about products that we have here that could deal with the vaginal atrophy and dryness too?
Absolutely. In fact, we just brought on a new medical science liaison that you guys will have the opportunity to meet probably in the next month or so. His name is Dr. Michael Critchman, who's an OB/GYN and a leading female sexual health doctor. And we have a kickoff meeting next week with Sean and I. We're going to be expanding our making a women's health catalog. That's going to include a lot of vaginal suppositories, including DHEA, even diazepam, which is Valium, a benzodiazepine, some progesterones that can be inserted in a vaginal cream using the Pearl Topical to help with not only vaginal atrophy, but dryness and pain, and then also libido. So we'll have, just like we have a urology catalog and a weight management, we are going to have a women's health catalog in the next 3 months that'll be very comprehensive and address a lot of these issues.
Before I move on, I forgot to mention these two booklets that we have from clinical optimizers. This one is about PDE5 inhibitors, which it has a bunch, and this one is about the penile injections. It also has a section on patient education, on a brochure basically to give patients. But
you can grab a copy off my desk, by the way. We have plenty of copies.
I tried to produce more of these. They were very successful, and doctors love that, especially to give out to their patients too. Very hard to read, so don't concentrate too much on it. There are 3 columns in this table: medications associated with female dysfunction. There's a desire disorder, which I said that, you know, the actually sexual desire. Arousal disorder, which is staying excited, aroused while having sex. And orgasmic disorder, not reaching orgasm. And these are the medications that may affect each one of those variables. And you have, obviously, amphetamines. You have antihistamines affecting arousal. You have statins and blood pressure medications affecting desire. You have anti-androgens or hormonal contraceptives, like you were saying, affecting desire. And I haven't seen the data on testosterone, but that's very interesting what you said. Tamoxifen, which is for breast cancer, affecting not only desire but arousal. Contraceptives, even ultra-low potency, affect both too. Psychotropics like antidepressants and benzodiazepine, anxiety medications, all of them most of them affect sexual desire and arousal, and orgasmic issues. Like in men also experience a lot of lack of orgasms. Aromatase inhibitors, chemo, obviously, and histamine, H2 blockers like for heartburn or even allergies can affect desire. So, as I said, that's why I said before, it's actually a miracle sometimes, especially as we get older, because as we get older, we men or women tend to take more medications for different reasons. Okay. So the treatment for sexual disorder in women, and this was a really good reference I found, a really good review. As I said, there are some antidepressants treatments of sexual dysfunction. Wellbutrin has been shown to be good antidepressant because it doesn't cause sexual dysfunction, not in men or women. It's very stimulating, so sometimes some people don't like taking it because of that. Viagra and Cialis can benefit women with sexual dysfunction induced by SSRI or antidepressants in general. Female genital sexual pain disorders are complex, and they need basically a lot of psychological support too. Group cognitive therapy is also another thing that has been tried. Mindfulness-based interventions. Direct masturbation is recommended for lifelong anorgasmia. Anorgasmia is basically lack of orgasmic, reaching an orgasm. And as I said before in that special, I realized that a lot of, and these were young women too, were only able to reach orgasm by masturbation. Local vaginal estrogen therapy is recommended and preferred over systemic or oral estrogen for the treatment of urinary syndrome of menopause and related, basically painful sex. It's called dyspareunia. Vaginal dryness is the primary concern. Ostina is this drug that is also prescribed for painful sex, or what we call dyspareunia. Transdermal testosterone with or without estrogen therapy has been shown to be effective in the short term for low sexual desire. This is the only drug approved. It was approved in 2015 for libido in women. It had been declined once or twice before. A small company bought it, and a lot of women activists got involved. So it got approved eventually, which I was surprised, because it only really increased sexual intercourse by 10% in treated patients. And the side effects were, like dizziness. You cannot have alcohol with this drug, which really rules out a good date, really. Most of us have at least a glass of wine to relax. And fatigue and nausea is a side effect. And so the company has this tough things to know, so basically it's all related to the side effects. What works in a very small subset of women, ADI may cause sudden prolonged unconsciousness. Alcohol should be avoided when taking ADI. Hormonal contraceptives may interfere with ADI, actually increase the blood levels of the drug and cause more side effects. ADI may interfere with a lot of other drugs too. So this was made by the company because the FDA made them do it. So it's not, as you can tell, it's not a very fun drug to, it's not the drug that is going to solve this problem, but at least it opened the market. It opened the market for, once one drug is approved, companies say, let's go for that. Let's go for that indication, because now there is obviously one really ineffective drug that got approved, so that gives hope to other companies to look into. So there are other companies looking into different options. You may want to bring that up, the PT 141 and all that.
Yeah, absolutely. There's a lot of drugs in development. One, as we know, there's doctors are starting to embrace androgens and testosterone for women, which again is a compounded option, not available commercially. But now you have several companies that are looking at different peptides. You guys are familiar with peptides in the form of Simorelin and some of the GHRPs and ACG that we make. There's all kinds of different peptides that do different things in the body. One of them is called bromolamotide, PT 141, which actually is an analog of a hormone that you have in your body that determines skin color, melanotan or melanin. So people take that peptide, black market sourced to get tanner. A byproduct of that drug actually is PT 141, which causes not just mechanical performance function in men and women, so blood flow to the penis, clitoris, and vagina, but also libido enhancement. And it works very, very well. And it's something, It's been on the black market for a long time, and other countries have used it. So I know several people have tried it over many years, and works very well. Now you have a pharma company in the U.S. who's about to, I think they're making it to phase 3 now. So they're about to bring it to the market as a new drug. Sean has actually found a source for the raw material, so it's something that we're looking to compound for urologists in the female market as well. Of course, we'll make it different than what the commercial manufacturing companies come out with, and that's going to be a blockbuster drug for women's sexual function and men as well.
There's some side effects too.
There is, yeah.
It's like flushing and
A little bit of nausea first time you take it for about 10 minutes, but nothing too bad.
And you know what? I don't want to talk about this product because I really don't have any data. But I just found out this morning that there are 5 different formulations of the screen cream. So I'm going to let Jason take over this one. This is one that's a little more complex because it has 5 components, or depending, 4 or 3, depending
on the formula. So most compounding pharmacies make some form of this. It could be known as libido cream, female sexual cream, scream cream is another common name in the industry, but basically it's a combination of several ingredients that provide some physiological and some psychological enhancement in female sexual function. So some of the ingredients you guys recognize: sildenafil, which is Viagra. What does Viagra do? Viagra blocks the breakdown of nitric oxide, or CGMP. Well, the same thing works for female tissue, whether it's the clitoris or the vaginal lining fills with blood, and part of that blood flow has to do with their sexual function or the success of their sexual function. So things like L-arginine, sildenafil, those enhance nitric oxide, CGMP, bring more blood flow. Some of the other ingredients in there help with sensation, which is another important aspect. And then probably one of the most important ingredients would be the testosterone. It's vaginally applied. There's receptor sites in the vagina, just like there is in the penis, directly for testosterone to inhibit some action on increasing libido and function. Then, of course, some of that will get systemically and go to the brain, where the other receptor sites are located that are going to increase not only that drive, but that desire to have sex and that response to sexual stimulation. So scream cream is very, very popular in these niche areas where progressive doctors and patients have discovered it, because, again, there's nothing like this commercially. It's only available at compounding pharmacies, but it does work very well. And the reason I know this is I've worked at, with several compounding pharmacies over the last decade, and I worked with several clinics that use it. I've talked to many, many women, or the husbands of the women that are using it, and it does work very well if it's applied, at the correct dose, or they apply enough of it. So, and this is a perfect example of a compounded product, something that you can't get commercially, that's completely customized. You can go to 10 different compounding pharmacies and probably have 10 different variations of this formula, different ingredients. It's very prescriber/consumer driven, which, if you recognize in our other fields that we've done classes on, that's a reoccurring theme, that a lot of these products come from the doctors and even the patients that do their own research and get the doctors to prescribe these things. So it's a very interesting product, and I don't think here at Empower we've maximized the opportunity, because we went to the menopause conference that I sent you guys an email on, and also the other pharmacy I worked at, they utilize a lot of this. There's a lot of women on this. So being that we came from kind of a men's health urology background as a company, and we're just evolving into the wellness female medicine market in the last couple of years, I think there's a ton of opportunity here, especially after going to the menopause conference and seeing how progressive even institutional OBGYNs are prescribing things like this and testosterone for women. So there's a whole new market for us to open up with this.
I've heard this question before, and I really don't know how to answer it. I'm sure pharmacists would know, but is a product edible?
Edible?
Yeah.
No, it's a topical cream, and the doses in there are low enough to where, basically if you apply it topically, you're going to get absorption directly into the receptor sites in the area you apply, in addition to a little bit systemic. But when you eat something orally, it's got to go through the digestive tract and the liver, and a lot of the enzymes in that process will break down and negate most of the ingredients in there. Women do respond to oral PD-5 inhibitors. They respond to oral L-arginine, some of these ingredients orally, but you need a much, much higher dose for it to pass digestion and become systemic, whereas a cream will bypass all that.
All right, so I'm done. References, and then we'll go into questions. Before we do, let me make sure that everybody also on the Zoom call unmutes if you want to ask a question, and we'll go from there.
I have another question. Alprostadil is a vasodilator in bimix, trimix, and quadmix, right? So I've seen that in the UK they use that as a cream base.
Mm-hmm.
Is that something that we want to launch and power?
We've looked at it before. There's very low demand, and the reality is the outcome and the efficacy isn't predictable because everybody has different absorption rates. Just like with hormone drugs, not everybody responds to it. So you're not going to get a guaranteed outcome with doing a topical alprostadil on the penis, whereas an injection, you're going to always get the outcome.
That's a marketing ploy too. You know, if you Google Trimix, you're going to see Trimix gel.
Yeah.
Which the company even sent me a sample because they wanted me to promote it. Didn't work at all. That doesn't get absorbed through the skin. So otherwise we'll be selling a lot of that because you can avoid an injection, right? So much so Muse is a drug, and it has to be inserted in a pellet. So it's, for me, it's maybe there's more of a placebo effect because it really does not absorb through the skin. So all that Trimix gel stuff, and people are buying that. Obviously, they buy it only once. Think about it. When something doesn't work, especially when it comes to erections, you only buy it once. But a lot of people buying it once can make a lot of money to a scam artist. That's why I say. More questions? It's a hot subject. I mean, we threw a lot of stuff at you guys. Anybody? Let me see. Anybody from the online world? Asking any questions, make sure everybody's, let me look at the participants. Everybody's muted. Adam, Danielle, Jessica, anybody? Everybody's muted. They're all satisfied with everything we talked about. We're so good. Nobody has questions. Everything is being explained. Somebody, Adam. All right, you came online. Do you have any questions? Anybody or any comments?
That's right. The great news, by the way, that there's 5 different now configurations on the Scream Cream. Just my question is, on a one of the configurations without testosterone, is there anything that maybe is published or maybe just more anecdotal that, you know, if that product without the testosterone, is that going to, outside of maybe not increase sexual desire, are there any other aspects of not having testosterone in that Scream Cream that is, you know, not desired or would make it not, you know, the best configuration to prescribe?
No, you hit it right on the head. Without the testosterone is the only ingredient that's going to probably increase drive and libido and the desire. Everything else is more mechanical as far as blood flow, sensation, lubrication, which are all very important aspects to female sexual function. Most other compounding pharmacies I've ever worked with or worked with clinics that prescribe from actually don't include testosterone in their libido cream and still had great reported outcomes. So the testosterone can be more icing on the cake, but then if you look at the total picture and you look at that last aspect of desire and libido, that's just as important as the other aspects. So of course there's a benefit to that, but not all women have a problem with the desire or the libido. It's usually more or less mechanical. So lubrication, pain, atrophy, things like that the other ingredients in Scream Cream can help with by bringing more blood flow and volume to that area.
Yes, and also, David, if a woman is already on a testosterone cream,
you don't need that'd be another reason you probably wouldn't want it.
Why you don't want it? Because there are like 5 different formulations, compounded ratios of up to 4 to 5 products. I just learned that this morning. I didn't know there were Scream Cream 1, 2, 3, and 4, and 5 different ratios. With 2 of them without testosterone and 1 of them without Viagra. So.
On the same subject, may I ask another question?
Sure.
So, you know, and maybe we're going to touch on this, but one of the configurations is without the L-arginine, which is an amino acid. Can you talk about, you know, the reason why that is? And then, and I know the answer, but I wanted to know if it was just targeted towards just genital herpes, or, you know, any kind of herpesvirus that patient might have.
Both. So yeah, that's a really good question. Thanks for asking that. So herpes simplex, you know, the more common one that everybody has with the oral breakouts, or genital herpes. If you're in an active breakout, you want to avoid arginine So, which is why that that version is available without the L-arginine, or you could supplement with lysine, which is a little more complex. And that includes the oral simplex, because you think about sexual activity, you know, mouths are going everywhere. So you want to, you know, avoid that so you don't potentiate that outbreak, and that's why that you know, that formula is available.
Any more questions?
Nelson, can you hear me?
Yeah.
Hey, this is Adam. How are you? Thanks. It's been a great presentation. Question that I have is, and this is probably maybe geared more towards David as well, but why do we not use prostaglandin in our Bimix?
Well, because prostaglandin can actually cause some pain and irritation at the injection site. And it's sort of like hitting an ant with a sledgehammer if your ED is at a certain level that might not require that much of a robust response. Plus, it's always good to start with any drug and treatment that you're going to be on long term. It's always good to start low and go slow. So Bimix is the other two ingredients, which will help. You know, if you were to break erectile function down by levels, it might help with the first handful of levels of more mild to moderate ED. And it'd be sufficient for that, and it would mitigate some of the pain and the injection site irritation from a prostaglandin. And then, of course, you could step it up to trimix or quad mix, which would contain higher amounts of that prostaglandin in different amounts.
Also, the refrigeration requirements.
And refrigeration requirements.
Yeah,
so traveling.
That's probably the most fragile of all the you know, molecules in there. It requires, you know, refrigeration. Bimix works well. I tell guys, especially the ones that travel a lot for work, because they don't want to carry a little cooler. And there are coolers, travel coolers that the main use to carry Trimix or HCG also. HCGs. So that's another reason. But Bimix is, I've actually tried all of them, and Bimix works as well. It's just that I think most doctors know only about Trimix and they jump right. I think everybody that starts should try Bimix first, because obviously it's the two component, the refrigeration requirements are not as strict. And also, why jump into, you know, like you said, like a jackhammer over a problem that may actually require fewer components? So, yeah.
Good question.
Good question. Keep on coming, or let us know. We will have, as I said, we will have all these available online.
For video, and then you can also send follow-up questions via email too.
One more question.
Yep.
Yeah, so with Bimix being a lyophilized product, I thought all lyophilized products require refrigeration once reconstituted.
Well, there's two different components here. So yes, once reconstituted, it's best to refrigerate it, but with a prostadil or prostaglandins, you're dealing with a stability issue, an environmental stability issue, to where it degrades very fast when it's not kept cool. Whereas Bimix will degrade on a much lower plane than your prostadil. So you're talking about more of a stability thing than you are a dosage form issue.
Yeah. Except, you know, even a transatlantic flight, that's about 8 hours. That's, you know, that's the longest. You know, this is basically about traveling. Because once you get to land, it is recommended always to put it in the fridge so that, you know, it lasts longer. But I've had Bimix out for 3-4 weeks and it still works the same. But yeah, but our recommendation is always, we never tell the patient that it's always refrigeration for all reconstituted products.
Once it's reconstituted.
Okay, good. And one more thing, just point out, I know on the slideshow, the PD5s showed that they were different colors. Just an FYI that they're all white.
Yeah, that's true.
Yeah, the colors are just for effect on the marketing.
Yeah, good point.
Yeah. Let's keep all the other questions. Oh, go ahead, Tara.
Yeah,
one more.
Really quick.
Yep.
I don't know if this was asked, sorry, but antihistamine. So a lot of pediatricians, and are we setting up the younger generation to fail because they put them, pump them full of antihistamines, antibiotics, they put them on birth control really young?
Antidepressants, anti-anxiety medications, sleep medications.
Yeah, are we putting the kids on all of these things at so young, so it's essentially setting them up for sexual dysfunction at these young age brackets of 18?
We absolutely are. In fact, my generation, I think a lot of the problems you see that you would see historically in an older generation are happening at a much younger age because of that fact. And if you think about it, I mean, looking at it, when I was over at Defy, who sees a lot of patients, they were these patients were getting younger and younger, no history of anabolic steroid or trauma, anything and their hormone levels are lower than my grandfather's, who's 90 years old. But then you look at them and I would say 60, maybe even as high as 80% are on one of those drugs from the table. Antidepressant, Adderall, all these different things that doctors are prescribing, or they're taking recreationally. Alcohol, if they're not doing any prescription drug, they're drinking. And all those things will not only lower libido and erectile and vaginal function, but also testosterone, which leads to all the above as well.
And we're sleeping less because of the
higher stress lifestyles.
The electronics in bed. Almost everybody's carrying their phone to bed and exposing themselves with that bright light that
which lowers
shown to decrease. Even when you go to sleep, you have a more shallow sleep quality, and a lot of the hormones are regenerated through sleep cycle. I really think that's the main problem that we're having. That and obesity, we're all getting heavier, and all the data shows that the heavier you are, the more problems you have sexually and with hormones. So I think it's a lifestyle problem, but we're also the electronics, and that has changed, especially you guys. You're all young, and you basically grew up with these things. Be very careful. Try to put them away at 10 p.m. and don't look at them. And that's the best advice I can give you. So I was bad with that, and the data is so strong now. They've actually done sleep studies on younger populations that are sleep deprived, and when they think they're sleeping, they're not really reaching REM sleep, which is really key to regenerating all hormones. So anyways, my little suggestion.
We'll go ahead and keep all of the questions for email. You're welcome to email me or Nelson, or you can email Gabby and then she'll get with us, whatever is easier for you. But I always welcome questions. And the reason I also like email is then it creates a dialogue that you can look at, and then we can also share it with others as well. We'll get these videos out to you. So we've done an IV, we've got a testosterone, now we've got a sexual dysfunction video. So you guys will get these videos, they'll be available. We're also gonna transcribe them. And then some of them we'll make into little booklets, so that way you have something to maybe give the doctors and use amongst yourselves to train. So we'll have opportunity to revisit some of this as well.
I hope this was useful. Definitely practical, very practical information, right? That you can actually apply to your own life. So thank you so much.
Thank you.
Thank you.
Guys, bye everybody.